Hello everyone and welcome to this webinar. Thank you so much for joining us today. For those of you who don't know me, my name is David Gazai and I'm the Director of Member Services and Learning at Orchestras Canada. I'm very excited to introduce today's topic and presenter, but before I do that, I would like to mention that Orchestras Canada is a virtual organization and we all work where we live. I'd like to acknowledge that my office is based in Kingston, Ontario, on the traditional lands of the Anishinaabe, Haudenosaunee, and the Huron-Wendat, and recognize the enduring presence of the First People. Today's session will be recorded and made available on our website soon, and I invite you all to put your questions in the chat as the session goes. We're going to end today's session with a Q&A, and I'll be relaying your question to our presenter. Today's webinar treats a topic that is very important to most, which is health insurance. Each member orchestra of OC, as well as their employees and musicians, are eligible for AFBS's Arts and Entertainment Plan. We realize that some of you might not know what that is, that it exists, or if you do know, then there might be some details that you're curious about and you would like to have a more thorough understanding of what that is, which is why we put today's session together. I could probably tell you all I know about it, but instead we decided to invite someone that actually knows what he's talking about. Today's presenter will be Jason Sully, who has been OC's contact at AFBS, and I can speak from experience that he is the absolute best person to discuss this topic. Without further ado, I will now pass the mic to Jason.
Thank you very much, David. Good afternoon, actually, now. As David mentioned, I'm with AFBS. I've been in the benefit space for 25 years, 17 of those at AFBS. You'll get to know a little bit more us as the session goes on. What I thought I'd like to do is just do a health insurance 101. So we'll give you a brief touch on a high-level overview of healthcare in Canada, and we'll segue into the AFBS Arts and Entertainment Plan that all OC members have staff as well. And as we mentioned, we'll get into questions. So we'll give you an intro into everything. What is insurance? I'll give you guys a second to look at this. What we're doing is putting like-minded risk or people together, pooling them into a pool, spreading that risk amongst each other to make things more affordable. It's a contract that we're going to reimburse against any losses you may receive based on wording in that contract. Health insurance in Canada. So what we'll do is we're going to pay for any medical expenses you incur based off a sickness or an injury. The important thing about this is in Canada, all private health insurance is second payer. So you cannot compete against the government. The government is first payer across the country. So we just supplement all provincial plans. In Canada, every province and territory follows the guidelines of the Canada Health Act. They all share the same common features and benefits. There are differences throughout each province, so you can't just expect that each province will transfer over the same type of benefits. So everything is different, hence why we have health insurance and why we have travel emergency insurance as well. Easiest way to think about this is if you have a provincial health card, you're part of the Canada's National Health Insurance Program, we call it Medicare. So, what are the things that we aren't covered by for provincial plans? Dental, we'll put a little asterisk on. I'm going to go under the assumption that the majority of people here wouldn't have access to the Fed's new dental care program. It's in its infancy. We'll see how that goes, but we're going to work on a presumption that we're buying insurance. You're not going to be eligible for that. Outside of that, the things that aren't going to be covered are going to be your drugs, as mentioned, dental, your hospital stays, your paramedical services, massage, registry specialties, vision, all the things that are preventative measures won't be covered by your provincial plan. What you typically will get, though, in the gray box we have here, your dental, your prescription drug, your extended health care. So like I mentioned, these are your vision, hospital stays, registered specialties. You'll get travel emergency, and you'll get accidental death and dismemberment. This is the typical benefit offering for voluntary health insurance products you're going to get out there. The box in the red are some of the additional add-on benefits. So disability is an option. I can tell you from my experience in this field and the people that we deal with, disability would add pretty much double the premium on the program. So it's something that people may possibly look into to replace income, but it's not generally something we see in this space from people voluntarily buying their own insurance. Critical illness is a tax-free lump sum payment you get if you suffer for one of 25 or 30 major illnesses or diseases, so things like cancer and whatnot, and we're all aware of the life insurance. So why would you choose health insurance? At the end of the day, financial planning 101, I think the best way to do it illustrates each of these other points, but it's really assisting your healthcare costs, and we're managing those healthcare costs. So you know you're paying X amount of premium a month. You know what value you're getting from the program you're purchasing, and then you know what you also, what value other than what you're getting out of the plan on day-to-day claims you may get out of that policy. So it's just financial planning 101 and helping you assess that healthcare cost so you're not stuck paying a full amount if something catastrophic happens. What it is not, this isn't it's an investment into your health, but it's not an investment into your pocketbook. So it's not a financial investment where you're going to put in $1,000 of premium and you're going to take out 1,200 every year. There's no business model in the world that works like that. Typically what we're doing with insurance here with the healthies taking care of the sick. Will there be years where you use this plan more than you pay out? Yes. Will the majority of the years will you be, you're paying for protection in what you use? For the majority of years, will you be paying the premium and not getting what you're putting in? For the most part, yes. So it's important to know that you're not going to be making money off this every year. And strangely enough, people think that's how it works for insurance. I think where we'll separate ourselves later in the presentation is that we're a not-for-profit insurer, so we're not making money. So we're not the typical insurer that you're thinking of. A service that takes advantage of you. The problems that crop up for people who aren't used to paying premiums on health insurance are generally those of the expectations don't meet reality. So believe it or not, people don't read policies. So if you're coming into something and you're buying insurance and you think I got insurance, it's covered, that approach was going to lead to disappointment. So it's very important you look at the policy you're buying. That would be my most important takeaway. Read what you are paying for. So what are some of the things against insurance? Like I said, I've heard it all. And we'll start with the first one. I'll pay out more than you use, and I did touch on it prior to this slide. In most cases, yes, but that's the case with any insurance you have. You don't life insurance, you don't benefit it until you pass. Someone else benefits from that. Typically for the health insurance, these are day-to-day benefits you're making claim on, so you're getting value out of it. And then what we like to do at AFBS is we add other things to offer more value, and I'll get into those later. The second one, I'll self-insure. I'll pay for it as it happens. I can tell you now, based on all the people I've talked to, and even myself, you don't save up for your medical expenses if you'd even have savings at all. So this is more of an excuse rather than, a statement to make against this stuff. No one's saving to pay, a $2,000 bill you weren't expecting, or stay in the hospital for 30 days and pay $200 a day. Like, no one is expecting that. So managing that risk is the best way to do it. I'm healthy and I don't need it. We're all healthy until it comes to a point when we're not. The interesting thing about insurance is that, the very things that if you ever make the decision where, maybe I am interested in insurance now, the very things that you want to be insured for, oddly enough, will not be covered most likely when you want them. So for example, you'll see now if you quote insurance plans, they'll ask you, do you take prescriptions? Do you do massages? They're asking you these things because they're assessing your risk, and they're saying the things that you are taking will insure you, but we're going to minus this stuff. So getting in early is the best thing to do. Prolonging your health and getting into a plan is not the smartest thing to do, especially if you have health issues. But even if you don't, when you start doing things, it's gonna impact you negatively. It's too expensive. This is subjective. You shouldn't put a price tag on your health. However, based on what I do day to day and people we speak to and people we help, people are price conscious, so we're aware of that. I think the best thing to do would be to use or look at a product that offers the best value for you. It's all individual, what you're comfortable with. Something is better than nothing in most cases. But I think it's very important that you just don't value it by the dollar. Coverage is limited. I think where I'll touch on this is there's two parts to this. So we'll unpack the first one. If you are an employee, a part of an employer plan, and you come to something where you're paying for insurance on your own, it's apples and oranges comparison. Somebody is paying lots of money each month for you to have benefits. So comparing that to a plan where you're paying monthly premium every month, it's not going to be the same. Payouts will not be the same. So you'll see that if you look at different things. And I forgot what my second point was there, but the coverage is limited. So that's just the important thing we want to take away is that, and if you are getting insurance and then you are for the first time using these things, it may seem like, limited to some of the coverage or may not. But I think it's important to realize that when you're paying for something, a lot of these benefits that people use within that plan, your paramedicals, your drugs, these are all expenses and cost drivers that go up. They don't go down. So I pulled these stats a while ago from Sun Life. Unfortunately, they don't do these things anymore. They spin it in a different way now when they give the yearly reports on financial stuff, and a lot of it has to do with mental wellness things. So, but what I can tell you is this stuff is still all very relevant. Point two has gone up. I believe the last time I checked, the average Canadian spends about $1,500 after tax dollars on medical and health. That's irregardless if you're paying for a premium or not. You're spending those dollars. Third point there, people who had an accident or an illness caused them financial hardship. Some of the things in point four, if I recall correctly, on this 40% of people is, they get loans, they remortgage houses, they ask friends or family for money, they max out their credit cards. Like negative things happen when you're not expecting these medical expenses. And back to the original point, if you don't have something and you're caught with something major, it impacts us all. And just to prove that point for StatsCan, I know it's an old dated, but it's still all relevant. And there's nothing I could find that's more up to date, believe it or not. But what this is just proving and showing is just we're illustrating no matter what income level your household is at, your after-tax dollar spend is going up. So it's higher for lower tax. You're spending more money on your after-tax money on healthcare than for the higher tax income bracket. But the message here is that the cost from healthcare, if you have a plan or not, you're spending those dollars, and that those costs are going up year to year. So maybe if you are interested and you want to start testing the waters for insurance, some of the things you might want to ask yourself, take an inventory of what you do now currently medically. Do you go see a physiotherapist? Do you go to the dentist? Do you take any prescription drugs? Take an inventory of what you do each year, and start asking some questions. What you spend in a year, what coverages are you looking for? What are some of the things that you and potentially your family would want to have? Do you have a savings account? So are you going to get stuck with something if something does happen? Are you okay? Can you float that? What you can afford, very important way to look at it, not what the cheapest is. Do you have access to it? Who can be covered? Pre-existing conditions, and that's important. I know in our plan, we offer a guaranteed issue plan, so we don't care about your medical. Can you go get insurance that write medical? Yes, you get a good price if you're healthy, but pre-existing conditions play a big part in insurance. So if you get past the honeymoon stage and you want to get into the nitty gritty here and you want to actually look into getting serious about this stuff, some of the more serious things you'd have to look at is you're looking at, what the plan, what levels of coverage does it offer? What doesn't it offer is an important one as well. What are the things it covers? Are there limits on that stuff? What are the co-insurance amounts? Generally, it's not 100%. You're not going to get 100% reimbursement on things. It ranges from 50 to about 80%. So you have to pay that difference out of pocket, right? So if you pay $100, the insurer will give you 70% of those dollars. You're responsible for 30. So look at things like that. Are there deductibles? Some plans still require deductibles. Do you need a medical assessment? Do you need a medical? So there are plans out there where you can do medical underwriting, get a plan. And if you're pre-existing conditions, that's probably not going to be ideal for you. Or if you go to a guaranteed acceptance plan, you don't got to worry about that stuff. So see, these are some of the questions you want to ask yourself. Some of the areas you can buy insurance, obviously the OC. Through the OC, you have access to what we have in place. You could use a broker, which just offers advice and has access to different markets and different insurers. But this day for health insurance, you can even go direct to insurers now. There's lots of products out there. So there's lots of different avenues and channels for you to find products, but it's always a good idea to see, like, through associations like the OC is, do you have access to something first? Which brings us to AFBS. So we are a member-owned and governed, not-for-profit, federally incorporated insurance company. We've been around since '75. We insure about 17,000 self-employed people. We manage just under $1 billion member assets. And what separates us is, we have expertise and knowledge and compassion that traditional insurers just don't have. This is our specialty. We're only licensed to sell within the artistic community. We cannot sell insurance to people outside of this community. So this makes us a specialist in this area, and it makes us people who care about what we're doing. So why do we offer this plan? We want professionals in the arts who have access to affordable healthcare that's easy to secure and it's portable, so they can take it with you. So this is why we do this and what we do. Sorry about that. Things that make us different. We're exclusive to the arts, like I mentioned. We can't sell our insurance. We're not licensed to go outside of our box. We're not for profit, so we operate on a not-for-profit basis. We do not make any money off this. We charge what the costs are plus overhead. And it's truly artists helping artists. That's exactly what we are doing. The Arts and Entertainment Plan is personal health insurance created exclusively for the artistic community. Fundamentally, it's artists helping artists. And that's a good feeling to know that when you're offering this, that when you're buying this, and just for us to even offer it, we're doing a good thing and we're doing a great thing for our community. It feels real good to do that. Why would you choose us over other plans? We're affordable. Like I said before, we don't ask for any medical questions. If you want to pay for health insurance, it's guaranteed issue. You pay, you're in. We do enrollments the first day of every month. It's easy to join. We have an online enrollment tool. It takes literally 3 minutes to join. We make things easy. We want to make it as easy and affordable, hopefully affordable for the majority of people as possible. These are the benefits that are part of the plan. So you get all of these things, whether you have standard and comprehensive, and we'll get on the next slide, but all of these benefits. So the dental benefits, we have major and basic benefits. We have prescription drug. To give you an idea of how many drugs are on our formulary, we have about 9,500. And I think the Ontario formulary has about 4,000 or 4,500, maybe 5,000. We have travel emergency medical, extended healthcare. Again, those are your assistive devices, medical devices, massages, acupuncture, physios, vision care, hospital, all that stuff. We have a life and AD&D product and a member and family assistance program. And this would be a short-term counseling offering, whether it be legal counsel, financial. You have access to this program, which comes very handy, actually. 2 plan options, standard and comprehensive. Comprehensive is just as the word entails. You have higher maximums and a few more benefits in that area. And why we think the arts and entertainment works so well for people within the arts and staff within the arts is we don't ask any questions. We don't care about your medical stuff. If you want to come and join, you have access to the program, you can join. We make it easy for you to join. We offer you flexible payment options, so you can spread that premium over monthly. Portable is a key one here. So you're not tied to an employer. You can take this coverage with you. Once you have access to this program, you join AFBS and have this product, you have the arts and entertainment plan that can take you and travel with you wherever you go. You're not tied to anything. We offer family coverage, couple coverage, single coverage, so you can cover your family, cover yourself. If you're self-employed, if your father's employed, your tax premiums are deductible, as are the unpaid portions of your claim stuff. So that's a good point as well. And you have benefits for life. So all the benefits I showed you, you get. There's a couple of them that you age out of just due to age. The AD&D you'll age out of eventually. Travel insurance you'll eventually age out of. But your core EHC, extended healthcare, dental, and prescription drug will always be there. Pay direct option at the drug and pharmacy and the dentist. When that fails, or if that doesn't work for whatever reason, we also have an online claim submission where you can take a picture of your claim and submit a claim that way as well. And we're across the country. So we're nationally across all provinces and territories. And this is a slide just to compare with the other big insurers, as some of the names you're well aware of, and and it's a testament to us that we're even in this conversation with these big, huge insurers. And what we're showing you here is a standard comparison of our standard plan, and what it's outlining and just showing you is that you get more for what you pay for our plan as compared to the others with the standard. And I love this quote, and this is not my quote. This was a members of ours actually who gives a testimonial, and I think it's great. Problem with insurance is that you don't need it until you need it, and if you need it and you don't have it, it's too late. We got a couple. These are the organizations. We started with 6 organizations with our sister program, the Writers Coalition program, in 2009, and now we're well over 100 arts unions, associations, and guilds. So we're really proud of the work we put in and the people we cover. There, you guys right here. We'll see. This slide here is our standard plan premium cost. So that other slide, 2 slides prior to this, where I showed you where you get more value for your dollar. We actually for these programs, for this program in particular against the other insurers, you get more for your money with us, more for your value, more value for your dollar. And our plan options, and I know David mentioned this to me early, and it did go over my head, but this is, we offer these plans to staff and we offer it to individuals. So membership, however you define your membership. So everyone under OC has access to this however they feel fit, for individual members. And then also the employer can add their staff onto the plan as well. So we have many of the employers you saw on that list that actually insure their staff through this plan. How do I join? You can go onto the website, you get a quote, we ask for your date of birth, we ask for your province, and then you get a quote on the programs offered. You take that quote through and you can enroll in a matter of minutes. For those who would like to do the old-fashioned paper route, we offer that as well. And that's it for me. The email address is there. That's our phone number. That's our URL. If you'd like to get in contact with me directly, I'll be more than happy to sit down with everybody, go through policies. If you want to compare against others, we would love to have your business and we would love to have the people, but ultimately we want people happy. So if something makes sense and it's better for you and it's elsewhere, so be it. But if you are interested, we would love to have a chat with you.
Amazing. Thank you so much, Jason. That was super helpful and very, very informative. I see Lauren had just posted email address and the phone number and the website. So, makes things even easier. We did have 2 questions so far that came to the chat. The first one is a question from Christine Guptill. Is occupational therapy included in the extended healthcare benefits? And then what about counseling and psychotherapy?
Yes to all. I'd have to look at the details on that. Counseling and therapy. So the counseling, we've added a bunch of different providers on there the last couple of years for obvious reasons. There's 2 routes of going about that as well. When I talked about our member and family assistance program, that has short-term access to a counselor via in-person, over the phone, over Zoom, however you want to do it. You can start with that route and then take it to the insurance plan after. So there's 2 ways to hit that. So the member and family assistance program, then the insured program. And we do cover all therapists. There's a plethora of them, so you'd have to look at the website to refer them. But yeah, they're covered.
Perfect. And the other question, which came from April Voth, are there age limits?
Yes, there are. So you have to be we take you from 18 to enter, and then 71 is the max age that you can come into the program.
All right, we have another question that just came in. I am an artist with a disability. If we add disability plan to premium membership, would it multiply ×2 the monthly membership? And what does the disability option include?
I think that might be a thing directed for you guys, but if you're asking us for the disability is not something that the Arts and Entertainment Plan offers. It's an expensive, well, historically it's been an expensive product. I think the last time we looked at it, it would double premium costs. So we're working on a fine line, because the people that we access, we can't get to huge price points. So we've had three premium increases over 12 years, I believe. I think the highest being 3%. So we're very cognizant of price. We can't add something that's going to double premium. And to be honest with you, the majority of people in this industry and they wouldn't be able to afford premiums. So we're kind of where we're at is already too much for a lot of people. So that's not something we offer, unfortunately.
Okay. Thank you. We'll wait a little bit more, but so far that was all the questions we had. I think when I was discovering more about that plan, one thing that I thought was really convenient and really very much geared towards the artistic field in Canada is that your relationship is with the actual person, not with the employer. So if the person moves or if there's any sort of agreement with their employer, the price can be split 50-50, 30-70, whatever the agreement is. So I thought that was very, very great for this.
Yeah, to give some context to that is we when we rolled this out, we came to the organization, so we'd go to all the organizations across Canada. So, would you like to offer this as a member benefit for your members? It made a lot more. We didn't intentionally do it thinking that we'd get the employer business. So when we went across, we have a master policy. We issue individual certificates. So we always wanted the portability piece because we know the nature of how people work. The employer piece kind of fell on our lap. We're not a true traditional employer plan. We didn't intend to be like that. Some of the benefits of offering this way is it's a fixed budget item cost, because we don't fluctuate up and down. When you get into a small employer arrangement, premiums are huge, and most insurers won't touch you unless you have guaranteed money coming in, right? So that just kind of fell on our lap.
Gotcha. We got a few more questions. One is, do you offer coverage for customer earplugs?
Earplugs? We do hearing aids, custom earplugs. I don't believe so. Not for earplugs. I've never heard. If there's something we're missing on that outside of just a straight up earplug, no, we do not cover that.
Okay, because I know lots of musicians, especially people that have to sit in front of a brass section, or like 4 trombones, for example, that can definitely be a concern, or cymbals. Things could be very damaging.
Yeah, it's something that we have in common. We take everything that come in, any kind of suggestions or anything people ask for. It's not something that's currently part of the plan, but we review every November the program.
Okay.
We've never taken. We've always taken consideration what we can add. So if there's something, if somebody wants to send me a little more detail on what it is exactly, we'll definitely look at it.
Okay, perfect. And then there's a follow-up after the question about disability offering. I said that the person thought it was included on your slide, or there was a bit about it.
Yeah, so the first part of the presentation, I was just doing an overview of generally what you get in healthcare. So the gray slide I showed you was just what the bulk of the health insurance usually you get is. The red slide was just telling you additional things you could purchase on your own.
Okay.
That wasn't part of the actual A&E offering later on in the presentation. So I apologize if we mixed up that one.
No worries, thank you. And then one that just came in. Sorry, hold on. I'm assuming the $77.92 per month premium example is for individuals. How does the rate increase for families? What are the upper age limits for dependents/university students?
So we call them overage dependents, up to 26 if they're in school. Generally, the premium doubles, but there's a discount each time you double. So I believe it's 77, and then it's maybe 130. There's different for the standard plan, under 65, it's in Ontario, it's about $83.71, taxes in. So if you double that and take some down, I don't remember exactly. I'd have to look at that. Or you can find this stuff by just doing a quote on the website. But yes, it's discounted as you add dependents. Yes.
And 26 years old if the dependent's a student.
Yeah. If you're a student, you're 26. We do not cover adult dependents. That's something that people ask right now. Like parents that are living with you and stuff like that. It's just overage dependents. If you're in school, you can stay on until 26. But we are looking and it is on our radar because the overage dependent thing is getting to be a more societal norm. So that is something that we're listening to.
Amazing. A lot of great questions coming in. It looks like that's it for now. I guess we can give folks a few more seconds. Oh, I see someone raise their hand. Let me see. Hold on, Christine. I'll try to set it up so you can unmute yourself for a second. Or you can go ahead, Christine. You should be able to speak now.
Thanks. Yeah, you just missed my follow-up. I don't see occupational therapy listed in your paramedical. Like I see physio, I see speech, I see audiology. I don't see occupational therapy.
I offhand, I don't know. We cover a lot of therapies. I'm not sure exactly. If you review the website and go on the Learn More side, you should be able to download a PDF that lists them. Or if you go to the member side of the website, it lists all the different therapies on there.
Right. So that's exactly where I looked, and I'm not. It's just typically occupational therapists are excluded. That's the reason I'm asking. So it might be something for you to have a peek at, because occupational therapists can do a lot to help people with hand injuries and with mental health. There's lots there.
Yeah, I'd have to get back to you on that. I'm not the product expert on the actual fine details of it. If you want to shoot me a message, and then I can get back to you when I look at the policy. But if it's not on there, the occupational stuff, we can definitely look into everything.
Thank you, Christine. All right. It looks like we're getting people saying thank you for the information. So it looks like no more questions. Jason, if anything comes through, I'll definitely let you know and ask you the questions. But thank you so much. That was really great. I hope this clarifies a lot for people who attended. And as I said earlier, the session is being recorded, so we will share this on our website in the coming days or coming weeks. So if you have colleagues that might be interested, couldn't make it today, then you can definitely direct them to our website, and it'll be there soon. Again, thank you so much, Jason. This is great, and I hope everybody has a great rest of your day.
Thank you.
Take care.